Hey everyone, this is Professor Lewis. I just had a question about some vascular lung problems from a student and they were asking some questions, so I figured I would do a quick dossier to help you with the understanding. It is review, but it's good review. So let's get started. Just go over some vascular lung problems. So this is one example. You've got a pulmonary emboli or pulmonary embolus. Remember, embolus is moving, and thrombus stationary. Emboli is several. I've seen cases where people had just one, and then I've seen cases where people had several. So this is one example of some vascular lung problems. And remember, I said it's important to know the flow of the heart, because again, if you have got a problem because once the blood, leaves the heart and goes into the lungs for exchange, if there's a problem there with that exchange, there's going to be some pressure and problems in the heart, with the systemic vascular resistance, because you've got vascular resistance here in the lung. So just remember that when oxygen needs to exchange, there's also blood involved, there's volume involved that can cause some problems. So that is just one example of a vascular lung problem. So what exactly is it? Just to give you a review, a pulmonary emboli is blockage of pulmonary arteries by thrombus, fat, or air embolus or tumor. So therefore it blocks the alveolar perfusion, and that's what I just talked about. This is actually a picture of an actual blood embolus here that's clogged up the works. So this is an actual picture of one of these. Now, some other problems I've included, not to overwhelm you, but just so that you're aware that there are other problems that can cause some vascular disorders related to the lung and the heart. And what exactly is this? Well, this is an enlarged right ventricle. Here, I've circled it, due to cardiac and vascular problems. This can either be from chronic, so some pulmonary vascular remodeling, that you get increased vascular resistance. You want to think cystic fibrosis, you want to think COPD, emphysema, any kind of lung vascular problem can cause remodeling. And then you've got your cardiac functions and your structural changes. So any kind of increased wall stress, increased preload, that causes increased systemic vascular resistance. You want to think about a restrictive left ventricle filling. So even the left ventricle, because if you have problems with the left ventricle, what are you going to have? You're going to have a backup into the right ventricle. So that's why knowing the flow of the blood of the heart is so important. And all this, don't get overwhelmed with all this. This is just showing you some things that can cause some pressure overload. Of course, your sick lung circulation can, but think about you want to think about inflammation, stress, oxidative stress, cell apoptosis, all of these things, fibrosis, can cause this pressure overload here in this right ventricle. So you've got your pulmonary vascular remodeling, cardiac functions, structural damages related to cardiac, and then you've got your cellular changes that can be related in the right ventricle, all related to other things. So these are some vascular problems. So then you've got an injury occurs, right? This is just a little pathway map. So you've got an injury that occurs, pulmonary endothelial injury. So you think about your vessels, right? Your endothelial remodeling. So I've got a picture here of some remodeling, how if there's increased resistance, then you're going to have some narrowing. This endothelial is going to build up, and because it's working hard, right? So then you've got smooth vascular scarring, some muscle and vascular scarring that can occur, and then you're going to get sustained pulmonary hypertension, and then some right ventricle hypertrophy. So sustained pulmonary hypertension. You got to think, okay, this is hypertrophy now, but what about dilation? Well, over time, if there's a lot of extra pressure in there, this ventricle is going to be trying to work harder to sustain and to keep up, so it's going to get bigger, and then it's going to hypertrophy because there's not enough supply, right? It's going to get bigger because of demand, but it's going to hypertrophy because there's not enough oxygen supply to maintain this. It can, your heart's a great organ and it can compensate for a while, but over time you're going to see problems with sustained dilation and oxygen demand. So then, after your right ventricle hypertrophies, again, you got your body's wanting more oxygen. There's not enough. It could lead to cor pulmonale or cor pulmonale, depending on how you pronounce it, and right-sided heart failure. So that's kind of the progression of an insult, and this can take time. I mean, it can go pretty quickly depending on your physical health and other factors, but it can also occur over time. This right here is just some complications. You've got your pulmonary infarction, occlusion of the pulmonary vessel, again, right ventricle hypertrophy, pulmonary hypertension, which results in dilation and hypertrophy of the right ventricle that I've kind of already talked about. But these are some of your complications that can occur. And then I just wanted to throw this slide in here on pulmonary hypertension to give you a review. What is it exactly? It's definitely just elevated pulmonary artery pressure. So what does that mean? Well, you've got a greater than 25 millimeters of mercury at rest, and this can be primary disease. It can be caused from the insult to the pulmonary endothelial that we just talked about. Or it can be secondary, which results from complications of your respiratory, cardiac, autoimmune disorders. So you want to think about this, your lung, right? And all these alveolus in your lung. This is alveolus is one, alveoli is several, right? So all of these that are exchanging your carbon dioxide and your oxygen, and all done through the process of the red blood cells flowing through your vessels, right? Well, if this can't occur, then you're going to get some complications. You're going to get this. You're going to get the normal vessel, but over time it's going to remodel because there's not a good exchange or there's a blockage, and you're going to get some pulmonary hypertension. So that can be, like I said, respiratory disease, respiratory pulmonary emboli, different things like that can cause this. And then also, so you've got a decreased exchange, which results in your remodeling. And then you've got some cardiac. Think about your valves, think about your cardiac blood flow again, that can also be a factor here, and increased systemic vascular resistance or valve disease. So just keep all that in mind. Autoimmune disorders definitely So that's just your pulmonary hypertension, just a review for you. And then all of this can lead to cor pulmonale, the right-sided heart failure. And that's just going to segue us into heart failure. Again, some of it will be review, but we will also be going over our new content, cor pulmonale. So hope this helps. Quick 10-minute video for you to review some lung and vascular disorders and how they relate to the heart.